So the LymphaTouch device works in two ways. So on that lymphatic system, it actually increases that space, so working on that lymphatic drainage and that system, and also working on fascia and those deep fascial connections where the scar can get wrapped around and tight within those fascial connections, almost opening up that space, allowing the lymph system to work underneath and giving it that space between the scar and those fascial connections deep underneath the surface. So it's really easy to describe because it's a safe and effective and an easy tool to use. What I say, it's a bit like the waves of the sea. So lifting and lowering, working on that positive and negative pressure. And because the client can feel it working as well, they can feel it lifting the tissues and then they can feel it lowering as well. And you know, as manual therapists, everything we do is really down in the body, working on the body. Well, this is exactly opposite. So I use that really simple analogy of the waves of the sea, because then everyone knows how that works and then how the LymphaTouch device can work as well. This is one of the great things about the LymphaTouch device. Right at the beginning, when you're first using it with a client, I normally typically work around that 80 to 90 millimeters of mercury pressure first of all. You want to get the client used to the device, how it feels, making sure that they're comfortable with it. And then from there, I would increase in either 10 or 20 blocks. So you'd possibly go from 90 to 110. And how would I know to be able to switch this? Well, after about 5 or 10 minutes of using it at that lower pressure, you're constantly checking in with the client, making sure that they're comfortable, happy, that they're enjoying the treatment. Then once you start, especially to work over that scar as well, you can start to slightly increase it, still checking in with the client to see how they're managing with you, with the device on them, that there's no pain and the pressure is okay. And you see the scar starting to change underneath the surface of the skin as you're using the device over the top. Of course, you have to work within your scope of practice. There are guidelines from the LymphaTouch team that you can look at, but you always must assess each and every person using your clinical reasoning skills in a holistic assessment. Factors like diastasis and breathing and pelvic floor involvement, skin integrity, hydration, nutrition play a massive part in the scar recovery system. And using the LymphaTouch device is a great adjunct to looking at all of that. So in brief, to start at 80 and 90, and then to increase it as you as a clinician see fit within your scope of practice, always checking in with the client that they're comfortable and as you're starting to see the scar changing.